we are in a really unique position managing the NCDs, yeah, meaning taking away by step the fear of cancer, avoiding that people suddenly have a heart attack because we find it earlier. Yeah. Making sure that stroke can get treated within 60 minutes without longer term damage to the patient. These are super important case topics.
Welcome to Unnatural Selection, a show about competition, innovation, and the strategies shaping tomorrow's frontiers. I'm Nick Encina. Each week, we speak with pioneers shaping the future.
This is episode number 18, produced in partnership with Mass General Brigham's World Medical Innovation Forum. Today, we're talking about scale. Healthcare systems everywhere are being asked to do more, better, and at lower cost. For medical technology companies, that pressure is forcing a rethink of what they actually sell. In this episode, we explore the shift from devices to platforms, from instruments to systems, and what it takes to lead a global organization through that kind of transformation. Our guest is Dr. Bernd Montag. Bernd has been CEO of Siemens Healthineers since 2015. The company's 73,000 employees are deeply committed to pioneering breakthroughs in healthcare everyone, everywhere, sustainably. Under his leadership, it went public in 2018 on the Frankfurt Stock Exchange as Siemens Healthineers AG. And just a few years later, in 2021, it joined Germany's premier stock index, the DAX. Bernd's journey as a Healthineer began 20 years ago, when the company was still part of Siemens AG. He started in corporate quality management and sales in the hearing aid business, then moved into imaging systems. There, he held several positions as a product manager for computed tomography, head of marketing for the magnetic resonance business, and later, head of the entire computed tomography business. By 2008, he was named president of the Imaging and Therapy Division, overseeing diagnostic imaging and image-guided therapies. A native of Germany, Bernd holds a PhD in theoretical multiparticle physics from Friedrich Alexander University in Erlangen-Nuremberg. Let's go.
Bernd, welcome to Unnatural Selection.
Welcome. Thank you for having me.
It's really a pleasure to connect. As we spoke before, I have a little bit of a background in the medtech space, having been with PerkinElmer/Revvy for a few years. But to hear from your own words, we'd love to hear regarding your drive for innovation. What need or impact defines your work?
So I distinguish here between two groups. One is patients and the other is customers, because we are our primary customers are healthcare providers, but everything we do is done having patients in mind. And you quoted our purpose statement here with this: for everyone, everywhere, sustainably. And I am serious about this. So this means really what are the diseases 8 billion people are afraid of. And we are focusing largely on the NCDs, the non-communicable diseases, cancer, cardiovascular diseases, including stroke, now also neurodegenerative diseases, and think about technologies, how to systematically offer earlier diagnosis, better, more targeted treatment. Yeah, so that is the patient story, the patient need. I think it's pretty clear. Yeah, I hope it doesn't sound too broad. And then looking at customers, I mean, the big challenge our customers have is staff shortage, and also how to provide access to care. And we are looking at how can we develop technologies which help to offer better patient care for more patients. Yeah, I hope it doesn't sound too generic, but what it also shows is that the company has a big scope. Yeah, and it's also in the breadth of what it can tackle pretty unique, I believe, in the industry.
No, it doesn't sound too broad at all. And it's great to have an aspirational goal like that, and you hit two very key areas. Obviously, on the patient side, having some clarity and some guidance and direction when they have these horrible diseases, and then obviously on the healthcare side, you're in Europe, here in the U.S., it's the same problem: the shortage of manpower and the amount of effort that's required to deliver good quality care. If we dive into a little bit more detail. For people unfamiliar with the Siemens Healthineers, how would you describe the core business today and how that has evolved over time?
See, there's different angles to this. Um, I would One way to describe the fields in more, let's say, technical terms is we have a very strong and we have a clear innovation and world market leader in the field of medical imaging. Yeah, so think of CT scanners, MRI, molecular imaging. We have a strong position in lab diagnostics. So this is more on the diagnosis side. When it comes to treatments, we are in a very, very strong position in cancer care with radiation therapy, but also interventional oncology. And we have soon after the IPO, which you have mentioned, combined our business or acquired Varian, who is the clear market leader in radiation therapy and oncology in general. And we have also a very nice business, which is about interventional workplaces. Think of cath labs, angio labs, targeted stroke treatments. Yeah. So another way to look at it is we focus on the best possible characterization of the patient for early detection, for making the diagnosis, planning therapy, while on the other side of the house, we have targeted treatments to deliver the precision therapy derived from these informations of the other businesses. Yeah, and the glue between this is all our efforts and strength in digitalization and a pretty cool AI program which we are running. Yeah.
Yeah, it's amazing. And I think that probably segues really nicely into the new ambition initiative that you have. And from my perspective, it sounds like an evolution of the Siemens Healthineers offering from pure diagnostics more into therapeutics and really a partner in decision support for the clinicians. Is that the way? Is that a good way of looking at it? Maybe even morphing into precision medicine?
Yeah, I think I think the journey we are on, and I'm making now maybe the time frame even bigger a little bit before new ambition, and also maybe want to go in the future. I think when I grew up in this business, yeah, when we were part of the bigger Siemens, yeah, I think the idea was more like, okay, we do the idea of Siemens back then was, hey, we do everything which requires electrical engineering and electronics. It's energy, it's automation, it's appliances, it's also certain medical technologies. Yeah. So the idea of what we need to be good at is building good machines and standing out. Yeah. So I'm using the cliche of the German engineer. That's not wrong. Yeah. But it's maybe not enough. Yeah. That has evolved more in what is our role in dealing with certain diseases. Yeah, and that is why, when I answered your first question, I started with the NCDs and not with technical excellence. Yeah, because there's a purpose why we do this. Yeah, and that path to look at what's really our role in fighting cancer, what is really our role in contribution in avoiding heart attacks, what's really our role in helping people overcome staff shortage, or what's really our role in making our standard of care possible in Indonesia. Yeah. So to look at bigger challenges, I think that's the journey we are on. And that includes what you say, yeah, to not only think we generate a great image, for example, but to then think, what do you do with that image? Yeah. So here's the AI which helps to translate this image into the best possible treatment plan for that very tumor of that patient. Yeah, and then to innovate not only the machine, but the procedure, and with the procedure to innovate how a department runs. And then, I mean, thinking big, how does a health system deal with millions of patients?
Yeah. Yeah, even back when I was at PerkinElmer, I used to think also in terms of um, same thing as you said, right? So, you can either focus on the hardware, but then the hardware generates data. And as we become more adept at software development and now with AI, you can actually do more value. You can create more value with the data to solve bigger problems, right? So the analogy would be, do your customers want a hammer or do they want a nail in the wall, right? So do you stop at the hammer or do you actually solve the problem that you're trying to address? And so I think it makes total sense now that you're generating data to say, okay, how do we take it a few steps forward and start helping clinicians do their job better, maybe alleviate some of the burden and the load that they have and become more of a value added partner in the delivery of care, especially as you're looking more into the therapeutic side.
Yes, absolutely. Yeah. And I mean, there's a hierarchy of needs, yeah, from basic automation tasks, yeah, using AI and digitalization for this, which sounds mundane, but is super important, yeah, in a world of staff shortage and physician burnout and so on and so on. But also when it comes to access to care, when it's, in LMICs where maybe the trained physician doesn't even exist. Yeah. So putting AI for the routine into the system. But what we step by step do is solving, I mean, when I say solving big challenges, I mean, one of the topics I'm really pretty proud of, and normally I'm on a diet when it comes to the word proud, because it's always the beginning of complacency. Yeah, the risk is it is. Yeah, we have 4 months ago or so signed a 10-year agreement with the province of Alberta in Canada, which is 800 million Canadian dollars for us. But but the topic is not so much about the money, yeah, but what is the content? It's about how can we team up to elevate cancer care for 6 million people. Yeah.
Wow.
And that shows, yeah, that basically when it comes to including setting up an AI program in Alberta and so on and so on, yeah, but that shows that it's possible and it is a need, yeah, to, on the one hand, yeah, to stand out with great technology on a product or what you call hardware level, yeah, but then to step by step with, on the one hand, consulting, but then also with digital offerings and so on and so on, help to really solve system-wide challenges. Yeah.
Yeah. And we've obviously been touching on AI. The course of my career, I've seen, and I'm a computer scientist as well, I've seen the application of software in the med tech and medical field go from early data capture and automation, IoT, and now obviously with AI, the emergence. So, AI has been around for a while, but this version of LLM based AI has been around for just a few years now. As we enter this next phase of AI, and we're talking already how Siemens Healthineers is using this, but how do you see the field of medical technology evolving generally? Is it, um, what kind of leap is coming next, and how is Siemens positioned relative to that future? I know we've been talking about your use of AI. Is it something that you've invested more into and brought in more AI experts? Are they distributed across product lines, or do you have a central command unit, if you will, on AI that works across these units?
So we have I mean, basically both, but we are blessed with having a very strong central unit. I mean, central always has a bit of a connotation, yeah, but a real strong competence center in Princeton, New Jersey. Where I'm extremely grateful, yeah, because the person running it basically has put us on the map when when basically nobody was yet talking about AI, yeah. So when it was called machine learning, pattern recognition, and so on and so on. And this is a very, very strong center And in the combination, the starting point was basically the combination of the capabilities of AI with our strength in imaging. Because let's say imaging is one of the first and most obvious benefitor of AI. Yeah, because in data are very standardized. It's in specialist language. There's the DICOM data set. Yeah, that is the standardized way of how to store and send voxel-based images around. So it is very structured data. And there's the problem of a CT data set being super big and so on and so on. And then you can start looking at, hey, we have the AI algorithms to detect lung nodules, to find the coronaries in the thorax and look at and present it in a way so that the physician can make decisions very, very quickly. Yeah, so that has evolved a little bit naturally, but it's now a little bit the mecca for everybody who is closer to the business to discuss topics. Yeah. And this can be from speeding up MRI reconstruction to early attempts, yeah, to predict response control to certain tumor treatments and so on and so on. Yeah. So it's a competence center which is close to the medical application. But when it comes to the deep use case, this competence sits in the respective businesses.
Interesting. When we think about the innovation strategy for Siemens Healthineers, um, having been in a large corporate environment, I know that there are often very important demands on the people to upgrade a current product, fix bugs, ship out new features and new versions, and so on. And those are very important things, because they keep the businesses thriving and moving forward. But then that also competes with the attention you need to do true de novo innovation. How do you think about the ability, or maybe you already have a structure in place, but how does Siemens Healthineers satisfy the ongoing needs of the organization and its current clients while also investing in the future and future technologies and exploration?
Very important question. And I think, I mean, I give an answer which maybe sounds fluffy, yeah, but I think it's largely a culture and value topic, and it is not necessarily something you can solve by creating a future department or by setting aside a certain envelope of money which you spend into something. Yeah, so I think but what it culturally means, I mean, we are a company which values depth, yeah, and domain knowledge. Yeah, so we are, and I think this is in our industry super important, yeah, because I mean our customers are and best conversation partners are people like, yeah, the radiologist of MGB or the oncologist of MGB or of any academic medical center. Yeah. So they spot empty suits very quickly. Yeah. So on the one hand, it's always clear, yeah, that it's not only a commercial success, but also the idea of how do we move the field forward. As an example, yeah, and this may be the second time I should use the word proud, but I'm full of pride. I mean, one of our signature innovations currently, where we are absolutely alone, is the so-called photon counting CT. And that is a breakthrough technology which basically has redefined CT and keeps on redefining. We started the program in 2003, yeah, with material science, yeah, looking at how can you have a cadmium telluride material which directly converts X-ray into an electric signal, yeah, and it took 18 years to bring this to a commercial product. Yeah.
Wow.
So it was a burden in the P&L. Yeah. Through, so to say, yeah, you call it a startup, you call it cash burn. Yeah. It was a burn. Yeah. For many generations of people running that unit. I was also
Yeah.
one of them, by the way. Yeah. but it was part of the culture. Hey, the only thing, hey, what's the next big thing? Yeah, what is this? And we held the course, yeah, despite financial crisis or deficit reduction act or our IPO or COVID pandemic and so on and so on. Yeah. So, and I think it is important that in a company like us, you have something which you treat like a campus. Yeah. Or you look at yourself that on the one hand, hey, it's about a business, but on the other hand, there is the real thing you are changing comes from innovation, which, by the way, very, very often happens in collaboration with our leading clinical partners. Yeah.
Speaking of which, I believe you have a therapy command center that you're working with Massachusetts General Hospital, which from the outside it looks like a compelling example of a deep collaboration with one of your clients. Can you tell us a little bit more about that?
I mean, we are what we are working on. I mean, as an example, is we want to set up diagnostics, yeah, as a business or as a business. I mean, business is maybe the wrong word, yeah. But when it comes to new fields of medicine, yeah, in this case, diagnostics, I don't know whether everybody knows what that is, but it's basically the idea of having a special radioactively labeled molecule which detects typically a certain species of cancer in a PET image, but then you can use that very molecule, label it differently, and then it becomes a treatment, yeah, because that molecule goes exactly to the type of cancer. Yeah? So that is in very super simple terms what diagnostics is. Yeah, so it means there's a new way of doing things, and now it's the question: what is our role needs to be to help, not only to say, hey, this is now available, but to think through how do you do this? What is the information system for it? Um, how does response control look like? How do you know 2 months later what you have done with which patient when they come back and so on and so on? Yeah. So, and how do you make this? I think there's one topic which is extremely important also in this aspect of staff shortage. How do you turn things from an art into something which is a repetitive process? Yeah, as German as this may sound, yeah, but it's important, yeah, that it scales, yeah, that it doesn't depend on the individual learning curve of great physicians. Yeah.
I love that. Yeah, I mean, trying to get a repeatable process that scales is so critical across so many areas of healthcare. And the discoveries that you make in any given hospital are going to be so valuable. So it begs the question, and I don't know if you have an answer, a solution for this yet, but a lot of times when hospitals will, when they purchase or license a platform such as this, they'll want to keep all of the learnings, all the data internally for obvious reasons, right? It's like they claim patient privacy, but there's also IP involved. But if you're building this intelligent system that's a combination of diagnostics and therapeutics, decision support, is there potentially a way of extracting some generalizable learnings from hospitals so that the whole industry could benefit? Or is that kind of taboo and you can't touch that?
No, I wouldn't say it's taboo. It is just something which I believe sounds easier than it is in practice, but I think the field is definitely going there. I mean, let me maybe rephrase. I mean, I think it is one aspect which I find fascinating is, by the way, a quote of Doran Komanichu, who was running our AI center here. He says, in every medical interaction, whenever a patient talks to a physician, knowledge is created.
Exactly.
Uh, Basically, in every so. And the question is, what happens with this knowledge? Yeah, does it evaporate or whatever? I'm making, traditionally, this knowledge with a little bit of luck, yeah, or parts of it stays in the brain of the physician at least, yeah, so that there is a learning curve. Yeah, if he or she knows what's really happening after the interaction he or she had with the patient. Now, how to use, I think, but the challenge is that it's just not enough to collect all kind of data. Yeah, you need to know, is this good data? Yeah, and that is why just saying, hey, we are the Siemens Healthineers and we have the biggest installed base on the planet in terms of imaging and linear accelerators and intervention is not doing the trick here, because you basically need to very clearly look at what is the special topic you want to solve here, because as we know, over the last 100 years, the number of medical subspecialties has mushroomed, yeah, and rightfully so. And now the question is, detecting this version of lung cancer, how do you do this in the best possible way? And now let's look at the best possible data of the best possible institutions and make sure that there is no bias because of the ethnical background or whatever of the patient. So you need to define the problem very clearly, and you cannot just throw a huge computer on all the data and try to and hope that then you get smarter in some kind of an unsupervised learning. Yeah.
Yeah, it's um, the use of LLMs just in general public, one of the biggest limitations there is data. Once they consume the world's data, they need more and more for these models to become smarter. In healthcare is obviously no different, and these hospitals hold tremendous amount of data internally. So when I was looking into the Siemens Healthineers strategy, the system that you're building, and your further integration into delivery of care and precision medicine, I couldn't help but start imagining a world where you could potentially start extracting some of that data, obviously with your customer consent, but you can almost think about exploring different business models, different types of innovation, where it's like you could even participate in value-based care, where you can maybe come up with a profit model or different ways of using your system so that it delivers the value that they need, but then you start building that knowledge repository that's siloed in all these hospitals for the sake of making the system better and eventually healthcare overall. And I think when I think of precision medicine, I'm in that space, in the genomic space, specifically genomic newborn screening. The biggest limitation is data right now. Right now, we're focusing so much on capturing the evidence to make sure that it's safe and efficacious and it can be used responsibly and scalably and so on. But the biggest limitation is data. And the more that we can pull from all the various projects around the world, the industry as a whole benefits. And so I just see the opportunity that you have with these clients being tremendous for that.
Absolutely. I want to make one additional comment. Yeah, and this maybe sounds pedestrian. Yeah, but but is still important. I learned in my early years a lesson from a colleague of mine. Yeah, by the way, he's from Boston. Who basically said, when you um, when you have the choice between something where the claim of your product is, I make somebody a better physician, or I make a physician more productive. More productive always wins. Yeah, and 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 I think there's some good reasons for it. Yeah, so when in a lot of the use, and I think it sounds pedestrian, but I think it's super important when we focus a big effort of our AI activities on taking away the burden of routine work from physicians. Yeah. Instead of trying to solve problems the physicians cannot solve. Yeah. So I have respect for all the topics of clinical decision support and so on and so on. But physicians are so grateful. Yeah. I mean, the discussions and they don't have to document. Yeah. I mean, there's now that whole topic. We are not in this field. Yeah. Of you talk to a patient and automatically AI writes the documentation. The topic of coding. Yeah. I mean, the topic of as a radiologist, the topic of preparing the images, getting the right view so that I can make a diagnosis, measuring something, and so on. That steals a lot of time. Yeah? So in a way, I think a super important first, but not exclusive, it's not necessarily sequentially, but a super important step is making physicians more productive or taking away the routine. And that also makes them better physicians, yeah, because they can solve the topics, first of all, why they became physicians, yeah, but the harder problems, yeah. And sometimes we are too carried away by saying, oh, I do this mega correlations and so on and so on. So we need to find the right balance between what I call pedestrian and what are more visionary solutions. Yeah.
No, I entirely see what you're saying, and I actually don't think it's pedestrian at all. I think it's critical, right? I mean, sometimes we can overlook true value to our customer by thinking too big and too complex. And I think that your perspective is spot on, right? I work with a lot of clinicians here at Harvard and Mass General Hospital and the Mass General Brigham system. And when I talk to my friends and colleagues that are clinicians, the part that they don't like about their work is all that mundane stuff that could be automated. They don't like the note taking. They don't like the record keeping and all of the entry level work that they do. The stuff that motivated them to become clinicians in the first place was the human experience, is giving good quality care and developing a relationship with their patients. And so the more that technology now can start alleviating some of that administrative burden on clinicians, it eventually opens them up to be more productive and deliver better quality care, because now the 15 minutes or so that they have with a patient can be spent more having a conversation and really getting to know them, not only to diagnose and treat, but potentially to also prevent and have the foresight to anticipate, okay, what are your biggest risks and how do we keep you healthy in the first place?
Yeah, absolutely. Fully agree.
But I'm really excited about this command center. You know, really represents the beginning of almost like an intelligent care platform. Um, is that the way that you're thinking about this? Is kind of like an all-encompassing integration partner with the clinicians, alleviating some of this burdensome work and opening up clinicians to deliver really better care, because now not only are they more focused on the human, but you can start providing decision support. You're capturing data and providing analytics and decision support on top of that.
Yeah. I think, I mean, a word which, by the way, is also very often used in MGB, um, is the word systemness. Yeah. So, and what I like about the word, yeah, it's not only an MGB word. Yeah, it's like, then how does a health system uh, get better by being bigger? Yeah, and not only bigger. Yeah, or in other words, how do you scale medicine? And I think this is one of the biggest future challenges, but also exciting opportunities for healthcare. Yeah, that I mean, currently we see a lot of. I mean, we have seen and continue to see a lot of consolidation in healthcare globally and also especially in the US. Yeah, and there are good economic reasons. Yeah, from there's back office costs, there is better negotiation power against the payer, or the topic of I keep the patient in my system. Yeah. But we also know that basically the second wave is yet to come. And the second wave is I offer better patient care. Yeah. So if I use an example So I'm inventing an example, yeah. How are 100 radiologies, yeah, not just Gs, better in one, yeah, than 100 separate ones, yeah? So you can think there's some, on the one hand, you can think of, scheduling, so there's more, there's some, let's say, financial efficiencies here, but then there's the topic of how do you know what is you have a benchmark, yeah? How long, what are the best protocols? How many patients, what is the best throughput, yeah? And how do you have learning in this system? Yes, it's also an efficiency topic. But then comes the next thing. When you have 100 radiologies, you have maybe 2 people who are really good at pediatric lung imaging. Yeah. So how do you make sure that in this system, every image finds the right specialist? Yeah. So this idea of how do we make the delivery of healthcare a system, yeah, and how do we benefit from this is, I think, something we are just at the beginning, yeah, and we all know, yeah, when somebody in a smaller city or in rural Germany, US, I don't know, gets a cancer diagnosis, you get some, and then the question is, oh, I need a second opinion, or I want to go to MD Anderson, or I don't know, to the big names, because I have the feeling the care in Des Moines, Iowa is not the same as at Memorial Sloan or at MGB or at MD Anderson. But basically, that assumes that it's in the head of the physician I need to visit. Yeah, but the technology to diagnose and treat is basically available everywhere. Yeah, so how can we scale the knowledge of what is the best treatment of that very patient without the patient having to travel? Yeah. Because I mean, the internet is accessible everywhere, yeah, in ChatGPT, yeah. So I think it's a super, again, a mundane topic, yeah. But creating systemness is one of the big topics, yeah, and it's something we take very, very serious. But again, I mean, it's not something you switch on from one day to the other. But I think it's a super relevant topic, yeah.
Oh, absolutely. As you were saying that, I was thinking about rural clinics in Indonesia. Doesn't even have to be in the US. And as I think about the command center that you're working on with MGH, um, does it require a big infrastructure investment, or do you have a lighter versions that could be used at smaller hospitals and clinics that may not have the facilities or ability to implement something that heavy?
I mean, eventually this all needs to be, and I'm saying that maybe overused word, yeah, this needs to be cloud-based, yeah. I mean, this is, I mean, of course, in healthcare, there's always special attention, and rightfully so, to be given to topics like patient privacy, cybersecurity, topics, and so on and so on, yeah. But in the end, the best way of doing this is in a cloud-based deployment, yeah, because then the learning of the system, yeah, or feeding in the global standard, yeah, or the evolving knowledge becomes a problem of the back office, yeah, like we are used to whenever we use our smartphones, yeah. So so this is not a heavy topic, yeah. I think that from a technology point of view, I believe what is a bigger challenge to overcome is, and I don't mean this negatively, is convincing physicians, yeah, and because this also it's about new habits, yeah, um, and and I don't, again, this is not meant to be critical. It's a very natural thing. Yeah, physicians are trained to be physicians. Yeah, I mean, this is their profession. This is their identity. Yeah, so you don't take a change in how you do things lightly. Yeah, so this is why, there is the FDA for everything which is changing and so on and so on, but it's deep in the system, yeah, of how people think, yeah. So and how to make sure that this is really and the system really needs to be good, so that people feel like, okay, yeah, I trust that system instead of making my own call. Yeah, so it's also a lot of homework for us.
Yeah. To that point, a big part of what I've been doing over the last 8 years has been on the implementation science side. So way downstream and really thinking about how health systems adopt sustainable innovations at scale. And I completely agree. I think changing behavior for clinicians is hard, as it's a human thing. But generally speaking, it's also because Siemens is not the only company trying to change their behavior, right? There's also competitors, other companies, everybody's coming at them with new technologies. And so doctors have to be very judicious about which products do I use and how do I change my protocols, because otherwise I would be doing it every single day, 50 times a day. And what I have found is often the best way of doing that is to show them value. If you can show them 10x value for changing little steps, not even the big picture, you don't want to say, okay, if you do all these different things somewhere down the line and you're going to become more efficient. It's more like, okay, this little step right now, do this, and you're going to become more efficient at this. And then tomorrow we're going to do another thing. And then over the long course, you're going to see major efficient gains, but it's going to be one value step at a time. And that's typically the way that I've seen it. At implementation level. So, in a sustainable way.
Yes, I absolutely agree. But I think the additional, let's say, challenge is that it's not only one physician, because typically it only makes sense if everybody changes. Then you include, when you do a change, yeah. So, and that also means, I mean, I don't know, we are now on a Zoom call. Yeah, we are in Siemens Healthineers working with teams. Okay, yeah. So, and I'm very sure that there are fanatics who find Zoom better and others who find Teams better. And then, then you have that debate within your physician group. Yeah, so it's not only convincing the single physician, but it's also then getting to an agreement. And I believe there's something also which I learned to. I hope it's a learning. Yeah. I think what is the difference of somebody who grows up in a company or in an industry? Yeah, so I don't like the term industry so much for what we are doing, because it's so much about patient care and science and so on. But let's call it industry. And when you grow up as or get educated as a physician, yeah, in industry you learn very fast. That's always about improvement of the system. Yeah. Productivity. How do you make your R&D faster? How do you make the factory leaner? How do you, yeah, so it's the spirit of constant improvement of processes is not even written somewhere. It's just what a company does. Yeah. In healthcare, this is not how people get trained. I think the individual paradigm is mastery. I want to be a really great neurosurgeon. I want to be a really good urologist, but one is not trained to it. How can we do the neurosurgery department? How can we change as a group in order to be better? Yeah, it's not that they don't. It's not a type of thinking. Yeah. And it's not even, it's not even an established role. Yeah. Like in a company, you have the process engineer and the roles of people, yeah, and so on and so on. Yeah. So we also need to make sure that we don't expect things, yeah, from now with all the technologies which we also need people or who who had the chance to get trained in that type of thinking to some extent.
I totally agree. Yeah, that last mile of implementation adoption is not an easy one, and the more you think of it up front
Well,
on
I
how your
lost you.
products. Oh, can you hear me, Bernd? Can you
You
hear
are
me?
frozen.
Oh, can you
I
hear me
hear
now?
you, yeah.
Okay,
I
good. We'll
think,
cut that part out.
yeah, I hear you.
Um, yeah, your part came in fine. Can you hear me now? You can't hear me?
Now it's better. No,
Okay. Um, so fortunately, I got your whole answer, and so we'll cut out this middle section right now. Um, but yeah, that last mile of implementation is really hard, and the more you think of it up front as you're designing and creating your products, the better chance you have downstream and say, okay, let's not think about implementation at scale as an afterthought. Let's think of it up front. And so I love the way that you're thinking already about how clinicians think and what makes them good at what they do and what it is that incentivizes them. So with that, Bernd, you've obviously had such a profound effect on Siemens Healthineers from the very beginning, from its inception, and for the last 10 years. Thinking about your long-term vision, what imprint do you want to leave on Siemens Healthineers? And if you achieve it, what does it mean for the future of human health globally?
big word. So what I hope, is, I think there are certain topics which I hope which will always stay in the company. Yeah. So, and I think this, what I talk about, a culture of domain knowledge, of valuing science, long-term technology development, in addition, of course, of being financially successful, and the spirit of um, um, collaboration with academic partners, but really having patient benefit in mind. Yeah, I hope I don't sound fluffy, but I think that this is super important. Yeah, to maintain and further grow. And in that sense, I'm just continuing what I have been taught in this company. Yeah? More from a content point of view. Yeah, I um, I think that we are in a really unique position. And I say unique not only to say, look how great we are, but also how big the opportunity and also the responsibility uh, is we have. Yeah? And the topics I discussed in the beginning, yeah, managing the NCDs, yeah, meaning taking away, maybe not completely by step, but step by step, the fear of cancer. Avoiding that people suddenly have a heart attack because we find it earlier. Yeah. Uh, Making sure that stroke can get treated within 60 minutes without without longer term damage to the patient. These are super important case topics, and to not only do this in New England, yeah, but also in Indonesia, yeah. And I truly believe, yeah, that there is no company better equipped in being the, let's say, the the mastermind, yeah, or having the technology behind all this. There are potentially bigger companies here who that, hey, this is the one device you need for this. This is the one drug which is now the blockbuster, and so on and so on. Yeah, I always say we work on the healthcare system, or we make money by making the system better, while others make money in the system, yeah, by pushing certain procedures and so on. It's nothing bad with it, yeah. And my hope is, yeah, that we can live up to that promise, yeah, so that we really have the impact I described on patients, but also on customers. Yeah.
Well, that's marvelous. I mean, it's definitely a grand vision, and I admire you for having such an enlightened view Obviously, you need to be profitable as a company, but it looks like the way that you're looking at this, you really are looking at it at the ground level with clinicians and focusing on delivering better quality care in the long run. So with that, Bernd, it's been a privilege to get to know you and having you here on Natural Selection, and I look forward to meeting you in person at the upcoming World Medical Innovation Forum.
Yeah, looking forward to see you, and thank you for the conversation, Nitya.
That was Dr. Bernd Montag. Now, unnatural signals.
What's unfolding here is a quiet but massive shift in how healthcare companies compete. Selling advanced machines is no longer enough. The real move is becoming a platform, one that turns data into clinical value and helps entire systems work better, not just faster. Dr. Montag makes a subtle but important point. Innovation doesn't come from throwing more computing power at data and hoping insights appear. It comes from clearly defining the problem first. Without that clarity, even the best technology stays inert. There's also a long-term view at work. Optimizing healthcare isn't about maximizing short-term transactions. It's about improving outcomes over time, even when that path is harder to measure. The signal here is alignment. When business models, technology, and patient impact move in the same direction, scale becomes not just possible, but sustainable.
Thanks for listening to Unnatural Selection. If you enjoyed the episode, subscribe, leave a review, and share it with someone shaping the future. Explore more at unnaturalselection.net and connect with us on LinkedIn and Facebook. Until next time, keep evolving.